Good afternoon on this Monday, or could be evening for you, this Monday the 26th of October, as we start a new week and a new round of daily briefings on Cordova's pandemic response. And it's kind of a mixed bag here today because the news on the Cordova front is very good. The news for the state overall, though, is very not good. In fact, we couldn't really be more opposite in terms of those trends. So we're going to talk about that with Dr. Sanders today. Reaction to Cordova's success and reflection on what's happening statewide with cases beginning to grow very rapidly here, particularly bad weekend. But we'll have her put that in perspective and talk about some other things related to the state, a little bit about travel, and we're glad you could join us here 1 p.m., 5 p.m., and 8 p.m. on the radio and youtube.com/Cordova TV for those who have an easier and more convenient time accessing this information online. Well, it's interesting, Doctor, to see Cordova zig and the rest of the state zag as far as the shape of the curves. First off, has to feel pretty good to see our dashboard go back to zeros, huh?
Yeah, absolutely. I think Cordova has done an excellent job since this started of when we get cases, we as a community respond and know how to improve our behaviors and flatten the curve here in Cordova. Now, what we're seeing in the rest of the state and the rest of the country is a hard time managing the kind of explosion of COVID cases that we're seeing. Currently, the state reported that yesterday we had 348 new cases, as well as 50 hospitalized cases. We see across the country that there is an increased hospitalization rate. Here in Cordova, we have not had any of our cases require hospitalization, so we're still very proud of that. And we're thinking that that might be due to people doing an excellent job with practicing good hand hygiene, wearing masks, and maintaining social distancing. Sure.
Well, and hopefully continuing to avoid gatherings, which seems to be, yet I know we've said this a lot, but according to the reports coming out of the state, it's gatherings that are really causing the problem, at which maybe we can get into and kind of see what you've heard. But yeah, it was definitely a bad weekend. It was almost 900 cases between Saturday and Sunday, 300 and some Saturday, 500 and some on Sunday. So that's a whole lot of growth compared to where we've been. But, you know, that the numbers may sound a certain way, but then maybe are not as bad when you're in the profession and you know what to expect and so forth. So, I mean, when you see these kinds of numbers, does that fall within the realm of what you would have expected, or is it getting outside that now, do you think?
Well, I mean, I think we all recognize that the COVID-19 had the capability of causing widespread illness, and which is why we've responded so strongly. This is going in line with our concerns. We do worry about hospital capacities as we see the cases climb. When case numbers climb, about a week later, we tend to see increased hospitalizations. So we're certainly watching for that. As this pandemic has gone on, the medical community has become better at managing hospitalized patients that have COVID-19. So we understand the illness a little bit better and can respond in a way that seems to be improving our ability to save lives and manage patients that have this. But it certainly is a cause for concern and has us paying attention.
Do you continue to interact with Dr. Zink and Commissioner Crum and some of the other people that we hear speaking about this at a statewide level? And if so, how are they feeling about the direction the state's headed?
Everybody seems to be concerned. We do continue to have interactions, both direct and with the echoes that the state is doing. And I am absolutely impressed with the way that our state leadership has responded in their accessibility for medical providers, and even in small communities like ourselves. They continue to provide support and check in on us and make sure that we're doing okay on a very regular basis. So, but everybody is concerned with the trend, and really is trying to encourage people to help us flatten the curve again. Alaska's done it, and Cordova has successfully done this many times this year, and we need to do that again.
Yeah. Well, unless we think that, we're sort of protected from bigger outbreaks as a result of being a small town. News came out last week that Chivac, which only has about 1,000 people, actually led the state in new cases with something like 58 in a single day on top of some others. So had you heard about that one?
I haven't heard about that one, but, it's not. Sometimes you can get these super spreading events, and if you have a large gathering, particularly indoors, the transmission rates for COVID-19 in those settings are very high. So it's not surprising to see some places like that where the number of cases increases significantly when you have an indoor gathering. So
does that, am I remembering right from the news releases and the reports coming out of this state, is that really the primary area of concern as far as what's driving a lot of this spread in Alaska?
It seems that a lot of the spread is being driven by household gatherings, yes.
Yeah, and of course, you've routinely explained that it's hard, being nearly a year into this, that to continue to maintain the distance from other bubbles. There's that urge to reconnect, and yet at the same time, that seems to be the primary way that it's spreading around.
It is. It's hard for families to remain far apart. It's hard for people to continue being isolated. It's hard because we want to go with the holidays coming up. People are used to visiting friends and family in faraway areas, and it's just a really challenging year for everyone.
So what about traveling now? I mean, it would seem an argument could be made that going to Anchorage, for example, or Fairbanks, which is actually outpacing Anchorage in terms of cases per 10,000, that going to one of these larger communities in Alaska is sort of as big a risk as we thought was contained to the lower 48 if you were going to go to Washington or Oregon or New York or something like that. What do you think about travel these days?
Yeah, thanks for that question. It's very clear that when you're out and traveling increases your chance of getting and spreading COVID-19. We know that staying home is the best way to protect yourself from getting this illness. People absolutely can get COVID-19 while they're traveling and can transmit it to other people, so it's important that they remain cautious. For people that do feel that they need to travel and are going to travel, it's important that they wear masks, use hand sanitizer, and wash their hands frequently. Try to social distance when they're in areas where there's large numbers of people, like on ferries or trains or any kind of public transportation. You certainly can make individual behaviors and make choices that can keep you more safe during travel. I think one additional thing to consider when you're traveling is to have a plan for if you do become ill or you do end up testing positive, you need to have a quarantine plan so that you're ready. Yeah. If you are a contact, you're going to have to quarantine wherever you are for 14 days, or if you become ill, that strict isolation for the 10 days or until you're well.
Okay. Well, all good things. Anything kind of in conclusion here, final thoughts?
No, I continue to just feel so happy to be a part of this community that's working really hard. I know it's been a hard year for everyone, but we continue to do what we need to do to manage this illness and mitigate the risks for the community members around us that are more vulnerable. And I really appreciate all that everybody's doing.
All right. Well, I couldn't agree more, and thank you very much for some of your valuable time here on this Monday.
Thank you.
All right, thank you again to Dr. Sanders for joining us on today's daily briefing. These are heard on the radio at 1, 5, and 8 p.m. They're heard online as soon as we can get them uploaded to youtube.com/Cordova TV. We hope that's working out for you folks who need to catch this on a different schedule or who are maybe following from afar, checking in on Cordova as you possibly hear about what's been happening across the state and seeing how Cordova is doing in contrast. Of course, we always like to remind you that COVID19.cityofcordova.net is available. whenever you would like to check on Cordova's dashboard and get the other most current information. Our archive of these programs remains at youtube.com/CordovaTV. And we hope everyone will continue to be safe, to analyze their risk level carefully, and most importantly, not put us in a position where we end up overwhelming our healthcare system, which thankfully so far has not been the case at any point through this thing. Have a great day, and we will see you next time. Return to regular programming now on the Clam and the Eagle.